not, at some point, maybe as a key action point, perhaps between now and the next time we meet, we can set up another template, right, where we can start writing up these things for this particular study anyway. Okay.
Yeah.
All right. So what typically, do you want to speak to this maybe?
Yeah, so that's I decided to put what a normal chest X-ray should look like as a way of reference as we look at the actual abnormality caused by pneumonia. And just as a background to what pneumonia is, the classic bacterial pneumonia or community acquired pneumonia,
Yeah.
which is a pneumonia that you get from the community. The underlying pathology there is
what other so there's pneumonia you get from the community. Where do you get it? Where else would you get it from?
there's also hospital acquired pneumonia.
What's the difference between the two?
So the difference is the causative agent or the microorganism that causes the pneumonia, and also the appearances will be different, slightly different.
So I mean, like the
And
features on the medical image would be different.
the features,
Oh,
yes.
okay.
And also clinically, hospital acquired pneumonia and community acquired pneumonias may have a different cause. So
Okay.
you would find that hospital acquired pneumonia may be more aggressive than community acquired pneumonia. Yeah.
Right.
So yeah. So this one is actually based on community acquired pneumonia, the classic features of community acquired pneumonia, which
Okay.
is the most common. It's a community acquired as opposed to hospital acquired.
Okay.
Yeah. So the main, the pathology behind the pneumonia is that there's an infection. So the lung has been infected by this foreign organism,
Yeah.
and the immune system of the body reacts against the infection. The end result is that you produce pus. Okay, the
Okay.
end result of the fight between an infectious product and the antibodies of the body is a formation of pus.
In the lungs.
In pus, you also have dead white blood cells, and also because there is increased blood supply to that area where the infection is to deliver white blood cells, the blood vessels will actually leak a lot of fluid. So there will be a lot of fluid that will leak out of the blood vessels. In medical terms, we call it extravasation of fluid.
So all that
So
happens in the lungs.
in the lung, especially at the site where the infection is taking place.
Okay.
Yeah, and so what will happen is that you have these products, fluid, pus, blood, white blood cells, will now accumulate in the air spaces. Remember, the main function of the lung is to exchange air. It's
Right.
for air exchange. Yeah. So when you breathe in from your nostrils, the air will go into the trachea. Then it will go into smaller airways, main bronchi and bronchioles, and finally the air sacs, also called the alveoli. That's the last part of the airway. And this is where the gaseous exchange takes place.
Yeah.
So you find that this fluid that is leaking from the blood vessels and the pus and the white cells, they all accumulate in those air sacs. Now, on a chest X-ray,
Yeah.
the density of the lungs looks black. So the lungs, what you are seeing on those images, the lungs are those like, you know, I would the cone-shaped, like cone-shaped shades of gray.
Uh-huh. Hello, Ernest. Are you? I don't think I can hear you anymore. Let me just check here.
And
Oh,
they
there we go.
appear black or dark on X-ray
Right.
because they contain a lot of air.
Okay.
So the nature of an X-ray film or image is such that the areas where the X-rays are passing, where there's a lot of air,
Yeah.
the image will look dark. Okay. And where there is a lot of hard stuff, for example, bones, it will look white because these hard structures or materials in the body will absorb the X-rays, and those X-rays will not reach the film.
I see.
Okay. That's the reason why, if you look, yeah, I'm sure you're able to identify the ribs.
Yeah, the
The
ribs. I
ribs
was
will
going to say
look
the ribs.
white.
Yeah.
Yeah. And then the vertebral column in the middle there, the spine, those are bones.
Right.
Okay. Yeah. So depending on how dense the material the X-rays are passing through, they'll produce a characteristic shade of gray on the film. If that material is very hard, like bones, it will look white. Look at that L, which shows the side of the body, which means left. You've seen the marker there.
Yeah.
On the right image, the image to the right on top
Yeah. This
right
this
corner.
L here. Yeah.
Exactly. When you do analog, you actually use a metal shaped like L, which is superimposed on that image. So metal will look completely white because
What do you mean? So
that is a dense material.
there's a metal with an L on it. Or what do you mean? The L is a metal.
Yeah, there's a metal shaped like an L, which we use for analog. You put it on the cassette when you are taking the chest X-ray. So it is taken together as you image the chest. It is also imaged onto the film so that you identify which side is the left and which side is the right. For digital X-rays like this one, of course, you actually just type an L and paste it there.
Right. Yeah,
Okay.
because it's quite
Yeah.
intuitive. You know where the left side is, right?
Exactly. Yeah. So what I was trying to say is that the lungs will look dark. The areas of the lung will look dark because they have a lot of air. But the changes that happen when there is a infection with pneumonia is that that area where you have the air sacs are now filled up with fluid and the blood cells and pus. There's no longer air. Okay, the air has been replaced by that material. As a result, instead of that area looking black as we normally expect it to be,
Yeah.
it will begin to adopt a shade of gray that is denser than black. So it will start looking almost closer to the density of the bones.
So I think for me it would make a lot more sense if can I scroll down to the abnormal one so that I see.
Yes, yes, yes.
So
So look at that X-ray,
so
the next X-ray
this
there.
one is the abnormal one, right?
Which one?
The one at the bottom here, or I go further down.
Yes, that is. No, no, no. If, even that same
Even
one you
this one,
have
right? Yeah,
scrolled
because I
past.
yeah.
Yes, this is. Which area do you think is abnormal on that X-ray?
Oh, clearly to my left here, this side here. Yeah,
Exactly, exactly. So you see, instead of it looking black like the surrounding areas or even on the opposite side, it now looks white. So that is the area that has hardened because of accumulation of pus and fluid. There's a medical term that we use, especially in radiology, we call it consolidation.
Okay.
It has consolidated. Yeah, it has hardened, and its ability to absorb the X-rays has increased. So there are less X-rays actually passing through that area because it has been hardened. So on the image, it will look white. Okay. Remember, when X-rays pass through a material that is dense,
Yeah.
they will be absorbed, and the image will look white. When they pass through a material that is quite light, like air or fat, the the X-rays will penetrate through easily, and the image will look dark. So when you see an area of consolidation on X-ray, you suspect pneumonia. Now, there are certain characteristics of the consolidation that you are actually looking out for, which can actually help you or lead you to a diagnosis of pneumonia.
Yeah, because this
So
could
there are a
prevent.
number
So
of
the
things.
so the, because I mean, this dense area here could be as a result of something else, right? Another affliction,
Exactly.
right?
Yeah, it could be tuberculosis.
Right.
It could be an inflammatory process. It could, but there's a tumor there. All those will actually look almost the same like that. But there are certain aspects of that area that will actually help you narrow down to a diagnosis of pneumonia over the other causes of consolidation.
Okay.
Yeah. So that's what I actually started putting up there. Number one, it's the margins. Okay, thank you. The margin of that consolidation.
Well, what do you mean by margin?
So you'll find, so the surrounding, the perimeter of that white patch, the margins of that white patch.
Okay.
That's one aspect that you look at. And characteristically for a pneumonia, you'll find that these margins are not sharp. And probably going forward, I may actually add some stuff to this document so that I contrast it for better understanding with others. For example, if you had a lung cancer
Yeah.
in that same position, you would actually see it looking around, you could actually trace exactly where the consolidation is ending.
Yeah.
Or if it
I
was an
think it would
abscess
be.
or a
Yeah. I think
boil.
for me it would
Yeah.
be helpful if maybe. I mean, just out of interest, obviously, this may not necessarily be
Yeah.
very useful in terms of our write up for this, but for me, I think it would be helpful if I saw like an image
Yeah.
for somebody who's been afflicted by or with tuberculosis, for instance, so that maybe I better
Yeah.
appreciate the differences that actually are exhibited by these different pathologies, I guess.
Yeah. Yeah. So anyway, I'll do that, I think, in due course. But that's one aspect, the issue of the margins. So characteristically for pneumonia,
Yeah.
the margins will not be sharp. Okay. So that white patch will sort of blend, fade off and blend with the surrounding normal tissue.
Oh.
you know so it will be very white in the middle. As you go on the periphery of that patch,
Yeah.
it will start getting less white, and then a shade of black is coming in, so there's a mixture of white and black to some level of gray, until you end up into the normal tissue, which should be completely dark, the way a normal lung should look like.
Mm.
Okay.
Yeah.
Except in a situation where there is what is called a fissure nearby, which separates the different, lobes of the lungs. I think we can come to that later on. But
Yeah.
that's the first aspect, the issue of the margins. So the margins will be irregular, they will be poorly, marginated. The patch will be poorly marginated, fading off and blending into the normal surrounding tissue on the periphery. Okay. Um, and usually, that third point, C, limited by and outlined by, that is speaking to the fact that, the lung has lobes. There are 3 lobes on the right and 2 lobes on the left.
Uh-huh.
It's not one continuous thing. Okay? It has lobes, and, or let me say it has partitions. In those partitions, there is a lining called the pleura.
Okay.
There's a pleura which lines those partitions between the upper lobe and lower lobe. So usually when the infection is in one lobe, say on the upper lobe, it can't, the bacteria cannot easily spread across that pleural partitioning to the next lobe.
Why not?
So you find that if the infection, well, it does over time, it may, but so it may be restricted because there are fibrous bands across there where the infection is, it's difficult for the bacteria to penetrate.
Right.
So you may find that actually when you image, you will see that if the infection is very close to one of those partition lines, you will see an abrupt end of that white patch not crossing to the next lobe through that, by that fissure. So I think the best is for me to add more images to demonstrate what I'm saying.
Yeah.
Maybe part A should have its own image, part B and things like that.
Yeah, I think so. I think
Then
that
the
would be very helpful.
second entity,
Yeah.
yeah, the second entity is the density itself.
Yeah.
Okay. So the density, the appearance of the patch, that white patch, okay, it may be homogeneous or heterogeneous. Okay.
Yeah.
In the sense that sometimes you may, the homogeneity is that throughout that region that is consolidated, the whiteness of that patch is uniform. Then you say it is homogeneous. Okay? And that is characteristic of pneumonia. It will look uniformly white. Other disease entities will actually make it in some areas within the patch. Some areas look more white, others look more dark, others are intermediate or in between. Then you call that heterogeneous. But for bacterial pneumonia, which is this community-acquired pneumonia, typically the patch looks uniform, uniformly white. Okay?
Yeah.
And so that's what I'm trying to demonstrate in that image that is on top on your window right now.
Yeah.
You see, it looks, the whiteness of that patch in the right upper lobe. You've seen there's an arrow there
Yeah.
in the
Yes.
top left. That's the right side, yeah?
Yeah.
And you've identified where the white patch is.
Uh-huh.
That is in the upper lobe on the right, exactly. So it looks, somehow symmetrical in terms of all the regions look uniformly of the same whiteness. The second thing that it is also demonstrating, if you look at the lower part of that patch, have you seen that? Do you notice that it's straight?
Which?
Do you notice that it's straight, the lower part? The lower part of the patch, which you were telling me the abnormality, yes.
You mean up? Somewhere here?
Uh-huh. No. The lower part of that white patch.
You mean the lower part of somewhere here? Yeah.
Yes, exactly. Yes. You've seen how straight it is compared to the upper part, which is caved. It looks a bit caved on top. but the
Yeah.
bottom part is looks like straight, like
Straight.
there's a
Horizontal
transverse,
line or
as if
something.
there's
Yeah.
a transverse or horizontal line.
Yeah.
So there's a fissure there, which is stopping the pneumonia from penetrating to the lower lobe. So you see the lower lobe looks normal. It's dark. So the infection is only
What
restricted
exactly
to
is the fissure? What you
the
mean
upper
by
lobe.
what does the fissure do? Is it what is it
That's what I was saying, that there's a plural line that is separating the upper lobe and the lower lobe, which is difficult, makes it difficult for the infection to penetrate. And so it will be confined to one lobe as opposed to immediately spreading to the lower lobe.
mm,
So in this case, you notice the upper lobe is abnormal, the lower lobe is normal.
yeah.
Okay? Yeah. And then if an infection is caused by a virus, for example, COVID is a virus,
Uh-huh.
you will see that the you see that the opacity, we call it the opacity, that white, the whiteness, the white changes, the changes on the lungs which look white will not be as white as it is in a bacterial pneumonia.
I see, yeah, yeah,
So
but you
if you
can
look
see
at
that
this part
this
B,
one here. Yeah, but you can tell if
yeah,
you
you
compare it with the
exactly,
normal one, you can literally tell that there is something wrong, right?
exactly. There is something, yeah. Still, the margins will not be very well defined. You cannot tell the margins at viperera umu.
Yeah.
But again, it's not as white as the way the other one will look. But you still see that it's abnormal. If you went to the net and Googled ground glass appearance,
Yeah.
actually this terminology is adopted from this certain type of glass where if you want it to be, usually they use this type of glass in bathrooms where you can actually put this glass and light will be coming through, but anyone viewing through that window will not be able to see anything.
Mm.
Like you have a surface of glass and then maybe you use sandpaper to scratch it.
Yeah.
So it will look hazy. Okay, it will look hazy. There's that actually term that we often use also. It will look hazy. So they've adopted that terminology as ground glass. It looks like ground glass. Okay,
Yeah.
so that's what you actually see. And typically for COVID-19, this ground glass appearance will be on the outer part of the lung, not in the middle. Okay, that's not a representation which I've given you in part B or image B,
What is this
but
for though in image B? What sort of viral infection is this?
so well, this can be any virus, but typically for COVID-19, it usually actually confines itself on the periphery of the lungs, closer to the ribs, on the lateral sides of the lungs.
I see.
Yeah, but there I was just trying to demonstrate what ground glass appearance looks like.
Right. Right.
Okay. Yeah. So that is the that was the second part, the density. So we've looked at the margins, we've looked at the density. Now there's also this characteristic feature of pneumonia called the silhouette sign. Okay.
Okay.
So yeah. So what happens is that, remember, when we are talking about the pathology, what really happens in a pneumonia is that you have filling up of the air spaces by material other than air, which makes the lung in that region to become more dense and it absorbs more x-rays, meaning that in that area where the pneumonia is sitting, you tend to have not dark image appearance, it will actually look a bit white. So if this area is sitting next to a particular organ, for example, you will notice that it will be difficult for you to distinguish where this organ is ending, because right next to it the density has increased. I'll ask you to scroll back to the top normal X-rays for you to understand this.
Yeah.
Okay? Look at the graphic to your left.
Okay. This one.
Now, I'll show you what the heart is here. Are you able to identify which one is the heart there?
I don't know.
No?
Is it this white? I don't know. I'm just trying to.
Yes,
This
exactly.
white stuff, right?
That is the heart.
Yeah.
Yes, that is the heart. Yeah. Now, images in radiology are taken in such a way that you imagine that the patient is standing and facing you. So you are facing, when you look at this image, it's as if the patient is standing and facing you.
Okay.
We call that anatomical position. Yeah.
Okay.
So what is to your right is the left for the patient. So your case are right there where it is. For you, this side is the right, isn't it?
Yeah.
But for the patient, that's the left.
That's the left, right?
Okay. Yeah. So now I want you to go to the opposite side, the other side of the heart, which should be the right for the patient and the left for you. You see the margin of the heart, the border of the machine, of the margin of the heart. It looks very clear. You can actually follow it. Starting from the top, it curves down all the way.
Here, right? Is that what do you mean?
Yes,
This,
exactly. Yeah. Yes.
Uh-huh.
Have you seen how sharp that margin looks?
Yeah, I can see this.
Right. That is the left and the right. Now go down to where we were. Look again on the right side. No.
Which image?
It's upper. Yes.
This.
That same image. Yeah. Look at the same border on the graphic, on that drawing. Have you seen how it visually looks not very clear? It's not as sharp as it was looking in the normal. That same border, the right border of the heart. Look at it again.
Yeah. I can.
Yeah.
I see what you mean.
Yeah.
Especially this side, actually.
Yeah.
Especially.
Exactly. Yes. It's not as clear as it is. Okay. And then look at the actual X-ray accompanying that drawing.
Yeah.
You see that there's a patch there next to the heart, and you can't see where the heart is ending.
No.
If you go up again to the normal chest X-ray, you will notice that you are able to clearly follow where have you seen?
Outline of the heart is easy to distinguish from everything
exactly else. So when this silhouette sign is positive, it tends to obscure the margins, the nearby margins. Okay. So there are so many margins that can be obscured. In this example, it is the border of the right border of the heart, which has been obscured because there's a pneumonia sitting next to it. The same thing can happen on the left side of the border.
I was actually going to ask, say, okay, what would, okay, I see.
Have you seen
Yeah.
there where the arrow is pointing? Even on the drawing there, you can notice that it becomes hazy. You can't clearly see. Yeah. So that's what the pneumonia does. Okay. And those are not the only borders. Even the diaphragm. Now, here is the diaphragm. Excuse me. If you go back to, I think I can explain even on that image. Look at the drawing. And look at for demonstration of the normal. Look at the right lung. So that cone, which is shaded gray, that is the right lung.
This one, right?
Now, the lower part, yes, that's the right lung. Now the lower border there, which is curving like a dome, that where your cursor is, that is the diaphragm.
This.
That's the diaphragmatic dome. Exactly. Yeah. So the same thing can happen. Even that border is supposed to be very clear the way it looks like that.
So if it was affected,
But
if it
check
were,
on,
yeah.
yeah, check on the opposite side, the lung on the opposite
Yeah,
side.
the
Have you
one on
seen
the
how
left, yeah, yeah.
it looks blared?
Yeah, you can clearly
Yeah.
see that
And the
the
actual
problematic
X-ray,
one is the one on the left here, the left lung.
yeah, exactly. You can even check on the actual X-ray that is
Yeah.
married to that. You can see that you can't actually follow the diaphragm. So that's the silhouette sign. That's another entity, characteristic feature of a pneumonia on X-ray.
Oh.
Okay. Yeah. Then we can go to the next. I think there must be another.
No, this is,
Um,
you went up to E.
that's the end.
Yeah.
Yeah. So those are the main characteristic features of what pneumonia does to a chest radiograph or chest
So here's the
X-ray.
question. I mean,
Um,
I have a question,
yeah.
right? So what
Yeah.
you're showcasing here is like, classic pneumonia, right? What of like hospital-acquired
Yeah.
pneumonia? How would you distinguish it from, like, what sort of characteristics? How is,
Okay.
yeah? How do you distinguish it from what we're from seeing here?
Yeah. So hospital-acquired pneumonia will present with features what we call a nodular pattern. So these white changes, they will look like beads, okay, spread throughout the lung. So there will be dots in the lung. The white patches will be very, very small, but they will be dotted all over the place in the lung fields. So that is called nodulation. So it will not come as a patch, a white patch. It will come in form of very small nodules that are infiltrated all over the place in the
Out of
lung.
interest, are you able to include samples of those my images in this same document?
Yeah, yeah, I can. I can do that. Yeah,
Yeah.
I can do
So
that.
the funny thing about most of these, the funny thing about how these AI-centric solutions work is, and this is why, I mean, one of the hot topics currently is what they call explainable AI, right? Where you're able to explain, you're able to explain how your model actually works. But it turns out, like for something like this, it's so the way the model would work, the way the AI model would work is similar to how you would operate, right? When you work on these images
Yeah.
over and over again, just by, if somebody just shows you an image like this, if you see this, you'd be able to know what sort of affliction, what pathology this is. And so the idea behind
Yeah.
these AI models is what's crucial is the quality data that you have, right? So all you have to do is you're feeding this this model that you'd have implemented with a lot of examples, right? You're just telling it to say, this is classical pneumonia, this is hospital pneumonia, classical pneumonia, hospital pneumonia, normal
Yeah.
X-ray, this is tuberculosis.
Yeah.
And then once you give it a lot
Yeah.
of data, the next time you give it an unknown, right, something that you don't know, it will use its past
Yeah.
experience to infer, to say this is likely, hospital pneumonia, for instance.
Yeah.
Yeah, but anyway, yeah, okay.
Okay.
This is good. This is very helpful.
Yeah.
Okay, so the next stage, Nishini, I guess, like I said, I think I don't know if I entered this as an action point. What I would do is I will say, this is today actually. So we met today. I will say this has been done here, right? I will say I'll put an action point here. Let me know if you're okay with this. But I'll put an action point here to the effect that we will come up with, we must come up with, we start writing up these. We include write-up on classic features of, let's say, include write-up of classic features of pneumonia in study 3 paper by this. So I'll create a template myself, and then we can start fleshing it out. I'll just say period to create template, and then I'll start fleshing it out.
Okay.
Yeah. Yeah. This is good. This is one of thanks for this. Okay. Is there anything else you wanted? Is there anything else we had to discuss here?
No.
Yeah, just to ask, I don't know, the data, are you done transferring? Can I maybe?
Oh, yes.
Maybe come through or something?
I've finished.
So I have a class, I have a class between 12 and 13. And then afterwards, I will have a bit of time. I can come either 13 hours and come to your workplace if you be at work, or alternatively, so I don't know what time. You had said you were taking time off on Monday and Tuesday. So alternatively, I can maybe, you can let me know, I can pass through your place just to quickly come and pick up the drive. Anyway, just at your own time, maybe somewhere in the morning, just let me know
by
if
11
I
hours.
Yeah, I think that will work best.
Yes, I'll let you know by 11 hours where I will be. And please don't hesitate to remind me if I forget. If you notice I don't communicate by 11, just follow it up.
Wonderful.